Halima Adamu, a mother of 6, has just lost her husband as a result of a cholera outbreak in this village in Abuja's suburbs. Halima says no one knew what was wrong with him.
We tried all we could to treat my late husband, but he kept throwing up and defecating, losing lots of fluids, and he eventually passed away. We later found out he died of cholera.
Cholera infection causes severe diarrhea and dehydration that can lead to death if not treated properly. It spreads through contaminated food or water. Many rural communities in Nigeria are at risk of a cholera outbreak because they are densely populated with makeshift drainage filled with dirty water. The United Nations estimates that over 110 million Nigerians lack access to improved sanitation, while over 70 million lack access to safe drinking water.
This community is one of many on the outskirts of Abuja, which is home to mostly poor people who lack access to clean water and good hygiene. And as a result, many here have a history of cholera infection. The government, through the State Health Agency, is here to sensitize the residents on preventive measures.
Experts from the Federal Capital Territory FCT Abuja's Primary Health Center are here to sensitize residents of the community of Mpape. They are taught how to identify symptoms of cholera and report early to hospital for treatment. And for those not affected, they are taught to observe basic hygiene, including hand washing.
FCT so far has recorded cholera outbreak in 3 area councils as Kuje, Amak and Buari. Mpape is under Buari. Mpape now has recorded only 7 cases for now with 2 deaths, but we don't want it to escalate.
Ibrahim Sule, the community leader, says apart from sensitizing them, the government needs to provide basic amenities to avoid cholera spreading.
I am pleading to government if they will come to our end so that they will be able to remove these riffles and provide us a very good drinking water. I'm sure some other diseases will minimize.
However, health experts believe the residents also need to play a major part.
It's a very poor community, and poverty is also directly or indirectly related to cholera outbreaks. But again, it's very, very important for the community members themselves to change their mindset and pay a lot of attention to their personal hygiene and environmental sanitation. The government can't do everything for us.
Although residents of the community have been taught how to prevent a further spread of the cholera disease, for Halima and her family, an earlier intervention may have prevented their loss. Ihaza, CGTN, Abuja, Nigeria.